Hi, Valeria. Thanks so much for the invitation. Thank you, Cartier and the West of the IMCAS team. Amazing presentation. You helped me a lot with the introduction of my lecture. Well, I want to talk about this topic, and not only about microneedle. I want to share some experience that I combine different kind of wave frequency. I start right now. This is part of my brief CV, the important part that as Valeria and Alexander, we are IMCAS America Scientific Committee members. I don't have any conflict of interest for this presentation. Well, definitions. Skin laxity is the sagging or loosening of skin that occurs when it loses its elasticity and usually appear in the abdominal area after or associated with pregnancy, rapid weight loss, and aging. The other definition is about the striea or stretch mark are synonyms. A linear narrow stretch or band that develop on the skin due to rapid growth or stretching of the skin are similar as scar. This is a really good point to stop, because as similar scar, we can get improved, we can reduce, but never can erase that all forever. Because it's as a scar, it's going to steal our skin forever. But we have a lot of skill, we have a lot of tools to get improved, and we talk about that, to get improved. Usually appear in the abdomen, breast, thighs, buttocks, and often associated with pregnancy, rapid weight gain or loss, and growth spurt during the puberty. There's two phases in the striea. The first one is the redness. It appear in the first 6 months of development, and is inflammatory and appear discoloring. But in this phase, the important tool is the laser. I will talk about that in a few seconds. But the other phase is the one we are getting improved with the any kind of radio frequency device, especially microneedle, is because are white, because it is a mature phase, and it's one we can get improved by any kind of heat devices. There are different kind of technology. Alessandro talked about that to get improved not only the striea and at the same time the skin laxity as laser, wave frequency, or HIFU, ultrasound focused devices. We can use it alone or combine it. And there are different kind of lasers to treat this area. For example, ablative laser, non-ablative laser, and LAOB, laser-induced optical breakdown due to switch laser, act perfectly to the mature period, in the mature phase. But in the first 6 months of this kind of striea develop, it's better if I use any kind of vascular laser, like IPL, pulsatile laser, or diodo laser, because we can reduce the erythema, we can act over the vessels, reduce the quantity, and by this, we can reduce the size of the striea or the scar. The great headache of anyone to start to use a laser over these striea marks, because maybe PIH is going to appear. This hyperpigmentation due to the inflammatory reaction, and this take a lot of time and take a lot of any kind of treatment to reduce it, and not less than 3 to 6 months. That's why, for me, at least, the radio frequency is the best gold standard for the use for striea. As you know, Asian, Oceania, and South America skin tone are quite similar. This is all the tones in the world, but especially this one from below are the typical from our country and our continent. And for sure, you know too that dark skin type as FIPA 3, 4, or 5 have a high risk of develop PIH after any kind of treatment, especially laser treatment. As these three guys, this is me and my brother, a fan from Samoa. I'm really fan of rugby. I follow my rugby team, national rugby team, is the Los Pumas. And this is during the Rugby World Cup in France, in Nantes. Again, we have two possibilities when we have the first appointment with the patient. Maybe the patient has looked for a fast result, but she or he can handle with a prolonged posterior recovery time. But majority of our patients want to a gentle and shorter post-treatment recovery time. By this, I select radiofrequency treatment because usually laser, as I mentioned, have the risk of prolonged PIH. Great clue. The first clue I'm going to give you today, the first appointment, because you need to evaluate carefully patient expectation. If the patient look for total erase of the striea or complete smoothing of the skin laxity, it's not a good candidate for you or for any kind of treatment that you can offer for him or for her. Because of course we can get improved, but it's not magic. Another second point, even that radiofrequency devices, especially microneedle, have less risk of PIH and prolonged erythema, we can have this kind of problem that need to tell that to the patient that in the way that this kind of treatment can affect his normal life, his normal laboral or social life. And the last one, you need to explain the recovery time and explain more than carefully the result that can appear. Evaluate the expectation because you have a long prolonged time with the radiofrequency because usually we the tightening, the stretching, and the stimulate of the fibroblasts take at least 1 month. That was my best result is always after the month, especially after 3-6 months. There's different kind of microneedle, you know. In the market, they usually have, I said, River Boca or Real Madrid, Barcelona. We have non-insulated and we have insulated microneedle. The non-insulated microneedle, and I use one have a fractional pulse mouth, giving the possibility to have a great volume of heat that is going to set to the swollen tissue in only one shot. That's why I prefer that because the heat and the coagulation or thermocoagulation effect is more important. All is about the impedance. The impedance is our skin layer resistance to any kind of fluid of energy fluid inside the skin. While we have a high resistance in the epidermis and hypodermis, we have a low resistance in the dermis. That's why usually any kind of radiofrequency device, in my case it's a bipolar radiofrequency, is going to flow inside the dermis, and this is the layer in which we want to act, not only in reticular and at the same time papillar dermis to obtain this stretching, this coagulation thermal reaction. By this, we can obtain an effect. And there's all a new microneedle type tips: the classical non-insulated, the new one semi-insulated, and the typical insulated. The non-insulated that I use is 5 millimeters length. That's why I can apply in all the thick of the skin without any problem. The semi-insulated is really interesting because we have insulated the first 2 millimeters to avoid any kind of lesion of the epidermis. Non-insulated the second millimeter to act on the papillar or reticular dermis. Again, insulated, and finally non-insulated to go deeper, for example, on the hypodermis. And finally, the classical insulated, in this case, with only 0.6 of the team can act. The rest is only insulated. Because our target, our objective is to create this volume of heat inside the dermis. By this, by thermocoagulation reaction, we can obtain the effect. Without that, it's like a massage, not only that. I have the opportunity to be invited as the same of Valerie and Alexandre to IMCAS World Congress last month. We talk about this topic, histological characteristic of insulated, semi-insulated, and non-insulated fractional radiofrequency microneedles in vivo abdominoplasty skin model. At this moment, I select a patient of mine who have complete indication of abdominoplasty, dermalopectomy of the abdominal area. I choose 12 samples. Of course, the patient was sedated by anesthesia. She don't suffer nothing at all. And after that, I select these parameters, similar for each kind of microneedle, same depth, same power, same pulse duration, and always with 2 stacking, with different kind of layers and different kind of parameters, but always the same for the 3 needles, okay? And here is the microneedle the 3 tips and the sample that I took for each one of them. And here is during the application. Again, remember that the patient don't suffer nothing at all because she was sedated by the anesthetic. Here is a close view of the 25 non-insulated microneedle and the sample that I choose to treat. Here is a close view of insulated microneedle, and you can see here only the tip of the microneedle it went to act. And the last one, the same insulated microneedle and the typical view as zebra, because have non-insulated, insulated, non-insulated, and insulated in the same needle. Finally, I performed the procedure. I take out all the excessive fat and skin in the lower part of the abdominal of my patient. I cut with the shape of a square all the samples, put in the little bottle, and sent to the anatopathologist, medical doctor. And this is part of the result. This is the typical view of any kind of non-insulated microneedle lesions. Okay, this great coagulation with the same size, with the same form of the microneedle, from the top to the lower part of the dermis, from the epidermis to the hypodermis. And this is a parameter that I choose. Again, a close view to notice that if I select great power, 25 watts, in a great duration of time, 200 milliseconds, it's better if I choose an insulated microneedle, not a non-insulated, because if you can see here, I have a little lesion of the epidermis. This is one of my conclusions. When I choose insulated, look the really clearly image of this kind of microneedle, because epidermis and papillodermis have any kind of lesions, are safe. But here is the great coagulation area due by this kind of microneedle. Only the tip is the area it went to react. Here is a great volume of lesion in the hypodermis due to these same parameters that the previous needle, the non-insulated, sorry, but in this case, all the area between the epidermis and the hypodermis is safe because was insulated. Again, a close view to measure well the great volume of heat that I leave on my patient by this kind of microneedles. And finally, the semi-insulated microneedle typical view is without lesion, with heat and lesion, without lesion, and again, the photocoagulation in the same patient, because I use this kind of insulated, non-insulated, insulated, non-insulated microneedle. And again, another view of this kind of semi-insulated microneedle, the typical view, safe, without lesion, the typical coagulation lesions, no lesions, and again, a coagulation at the hypodermis. This gives me the possibility to have some conclusions. The non-insulated act in all the layer of the skin. That's why for me it's better to use for skin tightening, for when I have the patient when skin laxity on the face especially, because when I want to act with a lot of energy, with a lot duration of time, I prefer this kind of insulated, for example, the navel or the abdominal area. And the classical indication for semi-insulated is for hyperhidrosis or osmidrosis. I was part of this develop of microneedle. I really proud about that. And first advice for you, if you want to buy any kind of device, first test on you or your family, because you need to be sure that you don't want to hurt, you don't have any pain, or you don't have any kind of lesion over the skin of your patients. That's why I was the first one to try on these kind of devices on myself. And well, take a look to my results. I talk a lot, but you don't see any kind of my result. First patients. Before and after or liposculpture. I use devices for liposculpture. Usually I use ultrasound cavitation on laser, Judo laser. You can see it's a good result. At the same time, I put some fat on the buttock. In the profile view, it's perfect. In the front view, you can agree that it's good enough. But if we use a close view, we can see that I leave in the surrounding tissue around the navel this laxity and fibrosis that the patient requests me a solution. Well, this is my solution. After 4 sessions with this parameter, with not the insulated microneedle, I have successful result. As you can see here, the patient love me, love my result, and don't have any more argument about my work. Another patient, the classical view after pregnancy, was a mother of 3, and you can see here not only striea, at the same time skin laxity, and this is my result with insulated microneedle because I use a lot of power, 23 watts, with 110 milliseconds at the depth of 2 millimeters, and this is my result in the half profile view. And we can see the patient in the front view, and with a close view, you can measure well the way I can smooth the skin, in the way I can, it's like if you pass an iron over the skin, and the way I have a reduction of the quantity of the striea. As I said, and I remember that, I never be able to erase all the striea, but I can get improved, as you can see here. And this is close to the last patient, in the way I can get improved not only in the navel area, at the same time, he had a scar for appendicectomy. During the same procedure, I performed a subcision and lipofilling on this scar. This is my gold standard endpoint. I look for this kind of weaknesses with this square form. That's why I be sure I send enough energy to be successful. I don't put the parameter here, sorry, I forgot that, but was between 25 to 35 watts, it's a lot. I use an insulated microneedle and with a duration time of 140 milliseconds. And this is my result. As you can see here, I measure well the way I can get improved not only around the navel, at the same time, of course, by the subcision, lipofilling, and microneedle, I have great result in this scar. When I combine different kind of radio frequency, I want to talk about fractional radio frequency because I can be able to have an ablative effect for only 150 microns, and I can set energy, volumetric heating, to all the layers of the skin because we can go deep to 3 millimeters. We can select ablation, volumetric heating, or both kind of effects. And again, I was the first one to test that on my face. I use anesthetic cream because I don't like so much heat, but it's good enough with this kind of anesthetic cream. I usually use on the face to get improved of these kind of scars, and by this I have the opportunity to have the experience to use it on the body of my patient. And here's a before and after, in which one I reduce at least part of the striea and get improved at least part of the scar after this dermal epectomy. And some cases I add transdermal wave frequency, in this case 3D transdermal wave frequency. It means 3 different kind of positive pole looking at the same time and negative pole. By this, they repel each other and go deeper in the layer of the skin. Again, I was the first to test it on my face. You don't feel nothing at all. It's a comfortable heat. And I use it really often in my post-liposuction treatment because usually we can reduce the time of swelling and erythema. And this helped me to using this
Fabian,
all.
Fabian,
Yes,
you have your time. You have 1 minute to conclude.
perfect. I can conclude. Don't worry. I have this kind of result, adding these two energies to this kind of device, and you can see here where we can tighten in the bottom two, and this I have this kind of good result. Yeah, on time. Listen to my
Yes, great
First,
talk. Good work.
well,
Beautiful.
thanks so much. Thanks so much. Wearable is a safe and delegate technology. I'm talking with you right now, and my assistant are working with in another room to my patients. It proved to have good results. Don't only believe on me, on my hands. Believe in all the lecture and all the published papers talking about these kind of devices. All skin type, any season of the year, is a non-stop device. We can work even in the summer, and here in South America, we have difficult summers. Avoid or minimize any kind of possibility of PIH. This is true when you compare with laser. Avoid any kind of complicated post-treatment, again, when you compare with lasers, and you can associate different kind of wave frequency to obtain better results, as I showed you a few minutes ago. Different kind of tips for different kind of purpose. I mentioned that during my talk. I invite all of you to the great IMCAS America in the beautiful city of Sao Paulo between April 11 to 13. And not only expect for 250 speakers and more than 2,500 attendants. Look for the best gala dinner party. Thanks so much
Yes,
for
I'm
all your
looking for.
attention.
Great. And I have to say that Fabian likes Black Party a lot.
Yeah,
Yes,
a little, just a little.
so we do have some questions for you here.
Okay.
Do you prepare the skin before the procedure, especially for darker skin types?
If I choose laser, I love laser. I love a lot CO2 laser and the effect of layer B when we switch it. Of course, we need it. Of course, we use melanocyte inhibitors as hydroquinone, as tranexamic acid, as kojic acid, but especially on my talk of today, using microneedle is not necessary. Of
You don't
course,
use.
in little you agree. If you have a little risk of PIH, but it's really few when you compare with lasers. That's why my first choice when I talk about skin laxity of the body or striea is microneedles.